Hey guys, and welcome back. Today we are going to be talking about what's next if you get a positive breast cancer diagnosis. So let's say, either you felt a lump, you went and got your imaging, you got a biopsy, and then someone, either the radiologist or maybe your primary care doctor, went through the results with you and told you, that you had a breast cancer. So now what? What is next after that? And remember that the first time you hear this news, you're not going to be taking in much information. You're going to be scared. You're going to be panicking. You're going to go into real fight or flight mode. So it's really important if you have someone in your support system that can come with you to these appointments. I think that's really, really important because it's hard to take in, necessarily all of the information as A, it's a ton of information, but B, you are in fight or flight mode, which we know from lots of research when you are scared and panicking and running from the saber-toothed tiger in your mind, you are not taking in a lot of information. You know that you have cancer and you're scared, but you might not be picking up all of the pieces that you want to be absorbing at the time of that appointment. So the first thing, once you get your biopsy results, they are going to set you up with a breast cancer specialist. So that usually is the breast cancer surgeon. That is your first person that you are seeing. Now, sometimes if you have a special type of breast cancer that sometimes requires medical therapy before surgery, they will refer you to what's called a medical oncologist first, and you might speak to them before you reach the breast cancer surgeon. Because sometimes we don't operate on breast cancer immediately. We actually wait for medications to be used to hopefully shrink the tumor down. We gain information on if the tumor is responsive to those medications, and you also get access to medications that you wouldn't other get access to if you got them after the surgery. So it's all very nuanced and confusing, so I don't want you to focus on that. But just so you know, it is possible for you to see someone other than the breast surgeon first when you get your diagnosis. But that's uh, what I would say is it's rare. It's not necessarily the rule. Or it's not rare, but it's the more rare type of breast cancer to have that situation. So that's not what I want to focus on today. What I want to focus on is the most common type of breast cancer, which the most common type of breast cancer that most people are going to be diagnosed with is called luminal A breast cancer. And what that means is it's a breast cancer that is typically slow growing. It's typically driven by hormones. So that means that the tumor is feeding off of excess estrogen or progesterone. So if you haven't gone through menopause yet, you still have those estrogen and progesterone circulating throughout your body. But if you have gone through menopause, even if you're postmenopausal, we still make estrogen and progesterone in our tissues, especially if we have any adipose tissue. So that means fatty tissue. The more fat tissue we have, the more estrogen we make. So, again, let's circle back. The most common type of breast cancer that women get is called a luminal A breast cancer. And that means that it's typically driven by estrogen and progesterone and typically is slower moving. So there's this number called Ki67 that measures the speed of the cancer, and typically this is on the lower end of that number spectrum. So that's the most common type of breast cancer that most women get. And lucky for most women, most of those don't typically require chemotherapy. But again, that's a nuance. That's a whole other can of worms that we'll go into because there are definitely other situations where chemotherapy is required. But the most common type, which is this luminal A breast cancer, is typically slow growing, it's hormone driven, and it's, like I said, slow moving. So good news, if you're playing the odds, you likely have this type of breast cancer. Okay. So when you have this type of breast cancer, like I said, it's slow moving typically and it's hormone driven. So the first thing that your doctor might talk to you about, if you're especially on hormone replacement therapy and you have a hormone driven breast cancer, is taking away those hormones in a guided and monitored way by the doctor that's giving it to you, because the cancer is eating that for lunch. Essentially, that's how I like to describe it to patients, is that's what your tumor likes to eat. So we want to starve the cancer. So that's when you have to take away hormones. We'll have a whole episode on things that you can do that is not hormone replacement therapy to manage those symptoms and to help you with that. So put a pin in that for now. But that's one of the things that is first going to be discussed with you, is preparation for, those hormones coming off, if and only if you have a hormone positive breast cancer. So that means you have a number from 0 to 100 that's above 0. That means you have a hormone positive breast cancer in the estrogen or progesterone percentage number. Now, the second thing that your primary care doctor will tell you is they're going to get you set up with a specialist. Now, depending on where you are in the country, you want to find somebody who is breast cancer specialized. Not everywhere has that access, but you want someone who has taken care of breast cancer before, because as you might gather from these videos, breast cancer changes constantly. It is one of the highest research specialties in medicine right now, and it is dynamic. We are finding out every day new treatments. We are changing things constantly. So you really, if you can, want to find a surgeon or person that is up on all of this, that is, reading everything and staying up to date on everything. But I know that that's a position of privilege too, right? And at the end of the day, you just need a doctor that is familiar with treating breast cancer. But if you are so lucky to be in a place where there's multiple options, you want to, look at your options and find kind of the person that, like I said, treats breast cancer commonly. And likely your primary care doctor is going to have that person for you. They're going to have a referral that they have worked with, that they know their results, they know, how it's doing, and go from there. So that'll be the second thing, is you'll get set up with an appointment with them. Now, if it takes a very long time for you to get into that person, I'm saying like a couple months, you might want to look around and see if there's someone else available a little bit sooner, because although breast cancer doesn't particularly move quickly, you don't necessarily want to delay being seen by months and months. Our goal is to get you in as soon as possible once you have a breast cancer diagnosis, and get you treated as quickly as possible. That is every cancer doctor's goal, of course, but there's only so many of them, there's only so many appointments. So, you just have to be mindful of that. And if you're going to be delayed for a very long time, maybe consider, maybe if there's another option that's also close to you that you could see in the meantime, and see if that's a fit. So that's the next part, is you're going to be set up for an appointment. And what do you expect at that appointment? What are they going to talk about? So basically, during that appointment, they're going to do 4 things. So the first thing is they are going to tell you what type of breast cancer you have. There's all different types of there's all different kinds of types, like I alluded to, but they will tell you the type that you have. And they know that from the biopsy result. Okay. The second thing they're going to tell you is kind of the pathophysiology of how this came about. In breast cancer, cancer develops in these little trees inside of our breasts that are hollow, and they bring milk to the nipple for breastfeeding purposes. And we can develop cancer commonly in the lobules, which are like the leaves, or the the leaves of those trees, or the ducts, which are the branches of those trees. And basically, the cells can kind of start filling up the walls. Then the abnormal cells can fill up the walls, and that's called atypia. And then once it gets full completely, that's called ductal carcinoma in situ. And then once the cells spill over the edge or the basement membrane, that's called invasive cancer. And invasive cancer doesn't mean that it goes to any other part of the body. It just means that it's spilled out of its little shell or container, and has a possibility then to get picked up by our first line of defense, which are our lymph nodes. So likely, if you have an invasive cancer, the doctor is going to talk to you about checking your lymph nodes at the same time. And actually, fun fact, breast cancer surgery in some situations is actually going towards not checking the lymph nodes, because in certain situations it almost never spreads there and it doesn't improve the lifetime or the lifespan, or it doesn't help the patient in certain situations. But I would say the majority of people do get their lymph nodes checked at this current day and age. So that is the other thing to expect to talk about at that appointment. Now, the third thing that they will talk to you about is if, surgery is indicated up front, or if surgery should be considered after some medical therapy. Now, I alluded to this earlier, but there's certain types of breast cancer that classically do benefit from having either chemotherapy or immunotherapy before, or HER2 directed therapy before surgery. And in those situations, you definitely want to be seen by both a breast surgeon and the medical oncologist. And basically, in those situations, they're all going to look at the pros and cons of doing surgery first versus giving medications first. And they will give you all of that information. And the surgeon will go through what the surgery would mean, the medical oncologist will go through what the chemotherapy and immunotherapy would mean, and then you can make a joint decision with all of that information. Okay, so those are the big things that I would expect at your first appointment. They should also kind of map out for you what the possible treatments will be in the future. Again, a lot of breast cancer surgery, or a lot of breast cancer treatment, can't necessarily be set in stone until after the surgery, but expect to have some kind of idea of what's coming next. And the most common scenario is that you get surgery first. That is the, most common situation. And we'll have a whole other episode about what types of surgeries there are, what you can choose, all of the options and all of the amazing things that we can now do in breast cancer surgery. So thank you so much for joining me. And just, yeah, to recap, let's do this real quick. So, at your first appointment, I would expect to go through the type of breast cancer that you have, the plan for if surgery is needed first or if medical therapy is needed first. Oh, also, you want to know the size of your tumor. So, they will go through imaging with you and tell you the exact size and location of your tumor. And then they're going to give you a final clinical stage. So, a clinical stage is made up of three components. So, the first component is the size of the tumor. The second component is the nodal status, if there's been any invasion of the lymph nodes. And the third component is distant metastasis. So, those three together give you your stage, which goes from stage 0 to stage 4. Stage 0 is, the smallest with the shell around it, and stage 4 is when it's spread throughout the body. So those are all things that you should expect to learn in your first breast cancer visit. And again, there'll be, all different scenarios, but this is what I would tell most people to expect at their first visit. So thank you again for joining me, and we'll be back